You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic of mini implants, Dr. Campagna. Dr. Campagna, welcome to the program.
Thanks for having me, Randy.
Okay, good. I have lots of questions for you about these mini implants. But first, your practice. I mean, who's the typical patient and who's the typical mini implant patient?
Well, the typical patient that we have, Randy, basically is everybody from children right up through senior citizens, everybody in between. So we do general dentistry, basically all the procedures that, including root canals, veneers, fillings. We do dentures, we do a lot of implant restorations, and we place a lot of implants, especially the mini dental implants.
Now you have this concept where you do everything under one roof.
We do everything from the general dentistry of fillings and that type of thing, but we also do our own root canals, we do veneers, we do crowns that we can make in a day that's a covering over the tooth.
Is that true? I mean, you have like, it's a big, like a lab right there?
Oh yeah,
Same day?
We have what we call a milling machine, and a milling machine is something that actually makes the crown itself, that the commercial dental labs have. We have that right on our own premises. Here's the nice thing about having a same-day crown. We could actually have a patient come in the morning, we prepare the tooth for a crown, and it had been breaking, and usually what we need to do is cover that with a temporary crown and get the crown back from a commercial dental laboratory. Several weeks later, we can have that done the same morning, and we do it routinely.
Moving on to the mini dental implants. So what are the type of patients and the patient problems that they're coming in for the mini implants?
Well, mostly, Randy, are the people that are coming in that have loose or ill-fitting dentures. And what we can do for a lot of them is take their existing denture, place the mini dental implants, and lock them down where the teeth will not move. And then they can function much like they did when they had their own teeth. In addition, we could also give a full arch of teeth that are actually glued in and don't come out. And they work exactly like their old teeth did way back when, before they had the dental problems that got them to this point. The other group of people are people that have teeth that are failing, that their teeth are going to come out. They can have dentures and they don't want dentures. So what we can do is we can place these mini dental implants and lock in the teeth that we're replacing with either a denture that's stabilized by mini dental implants, or we could even go to the point where we have enough dental implants, mini dental implants, that we actually cement them in, and they're there forever.
So a full arch of teeth that are just locked in.
A full arch, yes, and they won't go anywhere. They'll work just like their old teeth did. Now
at the top of the show, we said no more dentures. Nobody should be wearing a loose-fitting denture. You believe that?
Absolutely not. No, I agree 100%. Dentures basically is the wooden leg of dentistry. They could actually have a function, but they really don't work very well. And unless there's something, it's a balancing act. If they're just in the mouth, they're going to be moving all over the place, and it limits what somebody can do, what they can eat, what they can say, and we can help them by actually placing these mini dental implants and securing them, locking them down, so they have the confidence to go out and speak, to eat what they want, to eat peanut brittle, to eat more healthful foods like carrots, salads, things like that. This is something that they can't do with the situation that they have if they have the failing teeth, or if they have dentures that are just not holding on to anything.
Now, so if somebody has really bad teeth, right, like bleeding gums or gum disease, are their gums good enough to be able to get this procedure?
Oh, absolutely. When somebody has gum disease, what's happening is they're losing their teeth because the bacteria is melting the bone and the gums around that. And if that gets to the point where they cannot save the teeth, well, guess what? We could have another third set of teeth, the baby teeth, the adult teeth, and now we can have the implant-born teeth that will function just like healthy teeth, and they can have the lifestyle and the confidence that they did have when their teeth were working the way that they liked.
But I know a couple of denture wearers. They seem to be fine. Are you saying there's no such thing as a happy denture wearer?
Yeah, I'm saying that there really is not a real happy denture wearer. What you don't know, here's the little dirty secret. Denture wearers are hiding something. When they go out to eat with their friends, for instance, and they go to a restaurant, when they're looking at that menu, and everyone else doesn't know this, but they're looking at what they can eat. All right, they might not be able to eat a steak or a salad or something like that. So they have to have something that's softer. And it's a situation that is normal for them because they've been doing this so long.
They've adapted.
They've adapted, yes, but they've adapted to something that still limits them to doing things like eating, or aside from eating, singing or something where they have to be careful, because if they slide and they move, it's very embarrassing for somebody to have a denture that slips and moves around while they're trying to talk to somebody. And that's really what they're hiding. I know denture wearers that have told me this, that they never take their denture out because they don't want their spouse, who've been with them for decades, but they still do not. They want to time it just when they can clean it out, put it back in so the spouse doesn't see it. And that's really no real way to live, in my opinion, because they don't have to do that.
Now, where you are in Midland, I mean, are there a lot of people wearing dentures, like an upper-lower denture or headed dentures?
There's a lot of people wearing dentures everywhere, Randy, and the Permian Basin is no exception. I would say that the number, I couldn't quantify exactly, but what I can tell you, that if we took the people that are denture wearers or heading toward them, and we put them all in Grande Stadium, for instance, we could probably fill it 10 times.
If there's so many people, right, wearing a denture, headed to dentures, then why aren't they all coming in to get them a full arch of teeth locked in with mini implants? What's your take?
There's a lot of reasons for that, but some of the bigger reasons, I would say, is several of them, many of them have had dentures for so long that they've been out of the system. And they're basically living.
So they don't go to the dentist.
They don't go to the dentist. They basically have accepted that this is the best that they're going to have, and they don't really know that there's any options.
All right.
And that's one class of people. Another group of people are the people that have false teeth, but what did they do to get to that point? A lot of them have had failed root canals, teeth breaking. They've had countless visits to the dentist, and it ended up being all for naught. And the last person they want to see after they have gone through a miserable period of time.
That's a lot of money too, losing all.
It's a lot of money, and a lot of times you have to say, well, maybe it's not worth fixing teeth that are failing so much. And this is an option that we can present to them, to give them new teeth that aren't going to decay, that aren't going to break down like the original ones that they had. And the mini dental implants is a way that we can really help these people. A third reason why they don't come in is because they basically self-diagnose themselves. They say, I'm too old, or I'm too compromised to have something like this
done. How
old
can you be to do this?
There is no age limit that is to add quality to somebody's life. I know of somebody who was 101 years old who had gotten the mini dental implants, and they're thrilled.
I mean, why would a 101-year-old want to do this?
That's a great question. If a 101-year-old person wants to eat and chew just like anybody else. So I had this one 93-year-old who had breaking down teeth, but more importantly, he had removable partial dentures, teeth that would come in and out. And what we did was we basically replaced those by putting mini dental implants in where the teeth were missing.
All right.
And now he has regular teeth there that function like his natural teeth. And he doesn't have to have these basically not very good-looking removable partial dentures that weren't doing him so good.
So they could look good. They could look real, like teeth.
They
like
look
a smile
fantastic.
makeover.
They look fantastic. But more importantly, they can eat what they want to eat, and they can do what they want to do. They can speak without having to have something that they worry about all the time, like teeth that are moving around in their mouth. That's eliminated.
Now, I've had dentists on the show that say, well, mini implants are not there yet, that the regular implants are safer, they're better, and they're a little worried about these mini implants. What are the facts about this?
Well, actually, the facts, Randy, are that the success rate of the mini dental implants versus the older conventional style implants, they're basically the same as far as the success rate.
But you say they're much better for a few reasons.
I think they're better for several reasons. One is the success rate, which we had just mentioned. In addition to which, they also have less downtime. They can be loaded or be used.
So they're less invasive?
They're less invasive. There's no cutting, no stitches for the most part. And you don't even need as much bone as you would need for an older, larger type of conventional implant that has been used for the last how many years?
And costs, you say, are about half
Of course,
off.
are half or less than half than what the traditional conventional implants have been for many, many years. So there's less downtime, there's less invasiveness, and there's a lot less cost. And you have the same result, basically.
So let me get this straight. I guess the way dental implants are normally done across the country is two different doctors. You go to one person that might be a specialist that does the surgery, puts the implant in, and then the other dentist puts the tooth on top. You do both parts.
I do. The benefits are the convenience of that you're staying under one roof.
Okay.
And the other thing is there's a lot less cost, a lot less downtime, a lot less visits.
Because there's only one guy.
Because there's only one guy, and the technique. The technique affords itself to less visits and less healing time, less discomfort, less swelling.
So why do you like mini implants so much?
Well, first off, Randy, the reason that I like them so much is because for the 25 plus years that I've been a dentist, most of that time I have had a situation where I could not help people where they could afford to be helped. And now, when we use the mini dental implants, we could actually lock down teeth in someone so they're not going to move anymore, and they can go ahead and eat and eat things that they would like to eat. Eat whatever they want. They can go out. They could sing in the choir. I have a patient that was his thing. He liked to sing, and he told me he's actually upset. He says, "I need teeth. These teeth aren't doing anything for me," and he was actually mad. He was mad, and so what happened was, we went ahead and we did the mini dental implants where we stabilized the upper teeth and the lower teeth, basically locking them in. And now he's back. He can sing, and he's actually a DJ. So he's a entertainer. And now he can. And he even told me, he says, "Doc, I have a lot more confidence now." Because what kind of confidence can you have if you're hiding something like failing teeth or teeth that aren't fitting very well? And this is what he was going through.
So pain, I guess the bone doesn't really have feeling. So they don't. So the pain, it's not that painful.
The pain. We don't have to bore a large hole in the jaw. We put a little tiny hole in there, and we place these. There's very, very little discomfort at all. Most people have a little bit of sensitivity that night that Advil would
like
take
their
care
gums?
of.
Is it mostly their gums that are sore?
Mostly, I think it's the injection because we have to get a little bit of numbness going. The next day, for the vast majority of my patients, they have very little. Most of them have no pain the next day.
You give them pain medications?
I don't, no. In fact, most of them will either take Advil or Tylenol, and that'll be enough. And usually, that's just the day of the procedure. Next day, again, most people don't need any type of analgesics, and certainly no heavy painkillers.
What about during the procedure? There's no pain during the procedure.
There's no pain during the procedure because what we do is we get a little bit of numbness on each side of wherever we're going to place them, and that's all we really need. And they have no pain during the procedure.
Now you say that this transforms people's lives.
Oh, absolutely.
How so?
Well, for instance, I have one gal who I've known for many, many years, and she's the wife of a famous restaurant in Midland, and I made her dentures. And she would come and say, she says, "Doctor, I need a reline." And I told her, I said, "No, what you need is you need to have those dentures attached to something so we can lock them down so you don't have to worry about them moving all the time, because that's what the problem is. It's not a problem with the reline." And so we went ahead and we did that. And now she clips those in. She never takes them out. And she goes ahead her life eating and doing whatever she wants without having to worry about them moving anymore. And that's a real great benefit.
So how soon can a patient eat after they're in?
Generally speaking, they can eat right away. And I have a patient who I basically, this is another denture where very unhappy with them. We remade the dentures and had them locked in with the mini dental implants. And now he goes out and he eats corn on the cob. He basically is a very social person. So it's very nice that he can go out and he can speak to people without having to cover and worry about things moving around. And so from a confidence perspective, as well as a functioning, being able to eat whatever foods he wants, it's really made a difference in his life, and he's very, very, very happy about it.
Now, you say people with bad teeth are discriminated against. What do you mean by that?
Well, they are, and the way that they're discriminated against is, well, for instance, if you see on TV or a movie or something, you want to show somebody who's downtrodden, what you're going to do is you're going to give them,
okay,
or poor. They're going to see them with dark teeth or missing teeth, and they're going to make them look bad, and they usually look pretty miserable because they can't smile. They don't want to smile. They're hiding something. And the reason they're hiding something is because they're embarrassed. And this is something that is something that we see all the time. They cover their mouths when they laugh. That's a common thing. When I'm done with a patient, when I've given them back their teeth and they're solid, they're in there, they're not moving, they can smile, they can do whatever they want, I have to work to pull their hand down, and I have to tell them that that's what they have to do. They have to catch themselves because they don't have to hide anymore. We have a confidence they have to grow into, basically, because they're so used to being ashamed of the way that they look.
Now, you're a dentist. You probably think the smile's pretty important.
Oh, the smiles is absolutely huge. I mean, you can go through any of the surveys that all these big magazines, and what they'll talk about is what are the things that people look at most. And the top 1, 2, or even 3 things, they're looking at the teeth. They'll look at the eyes, but the teeth are extremely important.
Like what you find attractive in another person. That's true. I guess smile's always in the top 3.
I've always seen that, yes. Your original statement was, you're a dentist, you think the smile's important. Well, it's not just important to me, but it's important to everybody. Let's take a job interview, for instance. You have somebody coming in who's smiling, and they're confident, and then you have somebody who comes in, and they're not smiling, and they look a little bit glum. And who are you going to hire? You're going to want the person who's smiling,
that looks happy,
who's happy, who looks confident, and this is what we're looking for.
Now, do you see changes, like you fix their teeth, and you see changes in their personality?
I see big changes. I had one gal who came in, and she was missing teeth all on the upper left side of her upper teeth. And I told her what I can do for her, and she was thrilled because she could afford it. And we placed the teeth on the upper left, and she actually started crying. I wasn't sure what she was crying for at first, but then she says, "Doc, I have not been able to smile in 5 years. It had been 5 years that she was missing those teeth." And she had a beautiful smile. But now she could smile without having a big gap, and it meant the world to her. And I think she's great, but she loves me for that. And that's a nice thing.
Now, when they see their teeth for the first time, does it get pretty emotional?
It becomes very emotional. That's where you get people hugging. I get some hugs, even when I'm not expecting it. In life, if there's something about yourself that you don't like, really it does hold you back. I had a gal who came in, and she was missing a front tooth for many, many years. And I told her I could replace that with a mini dental implant and a crown. And I did. And after we did that, she was absolutely thrilled. She says, it's so nice to be able, she had a piece of plastic that she would put up there just for cosmetics.
Like a flipper kind of a thing?
It was a flipper, but it didn't do anything except give her a tooth in that spot. But when I replaced it with a mini dental implant and a porcelain crown, and it looked like the rest of her teeth, she was absolutely thrilled. She felt like she was 20 years younger, and she wasn't that old. She was a good-looking girl.
Okay, now you brought some models.
Yes.
Okay, so take us in on a consult. Patient comes in, and they either are going to lose all their teeth, can't save them, and they know they don't want dentures, or somebody that is existing wearing a denture. What are their options when it comes to dental implants?
Well, I'll start with the denture wearer. What we can do with that particular person, I'm assuming that they're loose because if it's the lower one, they always are. What we can do is we can go ahead and retrofit or place some of these mini dental implants to lock that denture down. But we don't have to stop there. We could stabilize them like that and make sure that the denture is not moving at all. Okay, the next level up is we can give a whole arch of teeth that don't snap in and snap out, but they actually are are glued down and they stay there forever. And that's the top thing that we can do. With the porcelain teeth, they can absolutely eat anything that anyone else can eat. Apples, steak, even the not so expensive steak, the tough steak they can eat, which is kind of nice. And anything under the sun they can eat, whether it's peanut brittle, you name it, they can eat it at that time.
Now you brought some are
I did.
What do you plan on showing me?
Here's an example of a lower denture. This is the one that is moving all the time that we've always had problems with. And now what we can do is we can put 4 small diameter mini dental implants in there, and we can lock that denture down to where it's not going to move. They can eat what they want. There it goes, pops down, and they don't have to worry about it moving anymore. And this was a great thing that I can offer the patients.
So that's option number one.
That's option number one.
Securing it to mini implants.
Yeah, now that's the lower. Now if we go to the upper, we do a similar thing, except in upper full denture works is it covers the palate, and the palate acts as a suction cup. But what we can do for these people that have this situation is we can place several of the mini dental implants in, and they'll be locked in similar to the bottom, but we take out the palate, and now they can taste more food. They don't have this restriction of their whole palate being covered. And that's a real nice thing because it feels a lot more like it's their own teeth. Now, from that point, we can go up to another level where we don't have dentures at all. Instead of snap in, snap out, we could actually have them where they will actually be cemented in and stay there all the time.
And what are they made out of, by the way?
This is made of porcelain. Looks just like regular teeth. There's no plastic teeth.
Do they look real?
They look
like
as
a cosmetic?
They look as real as a veneer case. They look fantastic. And that's a real nice thing because now they don't have to worry about them coming out anymore. They're going to stay in. They got regular teeth, no snap in, snap out.
What could they eat with those?
Everything that you can eat with regular teeth.
Could you eat nuts or like popcorn?
Absolutely. Nuts.
Like chewy
popcorn,
things like pizza?
Pizza, salads, everything, raw vegetables.
What foods do denture wearers have the toughest time eating?
The kind of foods that we're just mentioning, the ones that you have to actually use some force. Denture wearers need to chew on both sides, which is almost impossible. Most people chew on one side or the other. Denture wearers have to balance it because if they bite hard on one side, the other side's coming up or sliding somewhere, and that's a really, really tough situation for them. And that's why they have to worry about what they're going to eat, what they can order on a menu, and then again what they're going to say because they're afraid the denture is going to move if they enunciate or they try to laugh too hard. It's a terrible burden for them to have this situation.
Now we should mention, I guess, dental insurance does not cover the whole cost of this, even if you have really good insurance, and Medicare, things like that, covers zero with this. So what are you doing to help with these people?
Well, what we can do is we can offer financing. And with the decreased cost of the procedure overall, a lot of people will be able to afford financing and have the procedure done and have their teeth where they want to get them.
Okay, so mini implants, you're saying they work just, according to the study, just as good as traditional implants.
Yes, the same success
And they're
rate.
about half the cost.
A lot of times less than half, but yes, at least half the cost.
Lower downtime because they're smaller.
Correct.
And you could be any age to do this.
Age is not an issue.
Yeah, but isn't it true? If you've been wearing a denture for 20 years, you don't have enough bone to do this.
For traditional old style implants, that's been a big problem in the past. That means you're going to have more bone added so you can fit the larger implant. For the most part, with the mini dental implants, we can use the small amount of bone that's left over in some of these patients without having to do any extra surgery. We just use the existing bone that they have.
So even if you've been wearing a denture 20 years, you could still do this?
Even if you're wearing a denture for 20 years or more, we could, as long as we can find the bone, and we'll find it, we could actually go ahead and lock one of these dentures down where they will not move. On
a consult, how soon? So if a patient comes in here, how soon before they find out they're candidates? Like how soon
they'll
from
find
meeting
out that
them?
day.
So you'll know whether you can do it.
Oh, sure, yeah. We've got a machine that we've just gotten, which is a cone beam CAT scan, which gives a 3D image and shows exactly what type of bone they have. And and how much they have from a 3D perspective, and we can tell them with a high degree of dental certainty whether they would be a good candidate. Not everyone is, but almost everyone is.
Okay, so a consultation. You meet them on the consultation?
I meet them on a consultation.
No charge for the consultation?
There's no charge for the consultation. And everyone who's hearing this broadcast that comes in, on the already low price that we have, we give a 10% courtesy on the mini
If they mention the wellness hour.
If they mention the wellness hour, yes.
That's nice. Now, we are almost out of time. So what haven't we talked about when it comes to mini implants?
Well, the one thing I don't think that we mentioned yet, Randy, was the health benefit of being able to chew your food properly. With these denture wearers that have loose, ill-fitting dentures, they're just kind of chewing or trying to chew soft foods. They're not getting the fiber, they're not getting a lot of the nutrition that they really need. And really what this can actually do, in addition to making them more confident, making them eat better foods that are better foods for them, they can actually have a better health benefit by having the fiber and having the vitamins and nutrients and things that come with these better foods that they can't eat with the existing dentures that they do have.
Now with, is this one of those things when it's all done, they say, I should have done this years ago?
Always. That's what they say. They're sorry that they wasted so much time, and this is basically getting them on a road to a happier and more fulfilling life.
So even the people with the bad gums, like, you know, the bleeding gums and the bad breath and the teeth are loose, are their gums, are they too bad to get this?
Absolutely not. Those are the type of people we really want to see. Those are the people we can help because they're failing as we speak. They're failing because they have a bacterial infection. We get rid of the bacterial infection. We give them teeth that are strong, that look great, that function well, and again, they can eat whatever they want, and that's a real nice thing.
So it really is life-changing to get this done.
It is. There's a gentleman who came into my office who he had the neck brace. He was in a motorcycle accident. He broke the rest of the teeth on his top arch, and he had a lower denture. I basically did what I do with a lot of these patients is I went ahead and I placed several mini dental implants on the lower, locked down that lower denture, did the same thing for the top, opened up the palate. He feels like he's a young kid again, and he's back riding a motorcycle, which is nice.
We really are out of time. Okay, final message to the patient that maybe they have a few teeth left, but they are headed to dentures. There's no way they're going to save those teeth, but they're skeptical, right? Maybe they're afraid of this. And then the other group, the denture wearer, they've heard what you had to say, but they're still skeptical. What do you say to them?
Well, to the denture wearer, I say, come in, let me see your specific situation, and let me see if I can help you, because I know I can. Because what I'm going to do is I'm going to give you teeth that are not going to move, that are just going to stay down, so you can eat and do the things that you like to do. For the people that are on the road to full dentures, these are the type of people that if you come in, I could take a look. I can give you teeth that are fixed, that are not going to come out. We can put those in there, and you're right there on the road to recovery. So come in, know your options. Come in for free consultations.
All right. I want to thank you for coming on the show. If they have more questions, they can go to your website, learn more about this, learn more about you.
SmileMidland.com.
All right, thanks again.
Okay,
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.